Hello, my dear friends. I'm Dr. Vaishali Bharembe. I've been teaching anatomy for more than 25 years and I love it. Today, I'm going to talk about something very interesting. How do you explore the fallopian tube? In olden days, when you didn't have anything else, there was a wonderful procedure available called hysterosalpingography. So, what is hysterosalpingography? It's a procedure by which you explore the uterus and fallopian tubes by radiologically by injecting a dye inside. I'll show you beautiful images, you will understand what I'm talking about. Right. So let's understand the implication of hysterosalpingography and its findings in relation to fertility, or to be precise, infertility. Come. So then let's understand what really happens. Here's the secondary oocyte released by the female's ovary, picked up by the fallopian tube, brought into the ampulla. Secondary oocyte is waiting. Do the sperms come to fertilize me? Right. A bunch of sperms are released in the vagina. They make their way through the cervix, through the uterus, into the ampulla, and the two meet to bring about formation of an embryo. So you have to note in this that the patency of the entire tract is the one thing that is required for fertilization. If anywhere along this path there is non-patency, there cannot be a fertilization. There cannot be an embryo formation. Clear? Okay. So, what is hysterosalpingography then? Okay. We are probably investigating a case of infertility. Okay. So, what do? We inject a dye into the patient's vagina, passes through the cervix, passes through the fallopian tubes, and finally release through the two abdominal ostia to spill into the abdominal cavity. This is if the patient is normal. Okay, so you are going to see bilateral spill of the dye, and you're going to take an X-ray of the patient so that what you see looks like this. Come. So this is a case, this is a hysterosalpingogram. You're seeing a cannula inserted inside the patient's vagina. Dye has been injected. You can see the dye showing you a triangular section of the uterus. And here are the two spillage of the dye inside the patient's pelvic cavity, indicating that both the fallopian tubes are patent. Have you understood this? This is what is hysterosalpingography. What is the dye used? The dye used is called lipiodol, iodine-based contrast medium. So now what would happen if the tube was blocked? Come take a look. So here is the blockage, okay? So again you are injecting a dye. When the dye passes through on the other side, you can see that it has passed through the fallopian tube, there will be spillage. But on the side where there is blockage, the dye gets stopped at the block. So what do you find? That the spill of the dye is present only on one side, indicating that one of the fallopian tubes is blocked. Can that be the cause for patient's infertility? So this is how investigations are carried out to look for patency of fallopian tube. Procedure is called hysterosalpingography. It's a very cost-effective way of investigating for fallopian tube block. What else can be visualized by this procedure? Is it only to find out if fallopian tubes are blocked? You can find if the uterus has polyps in it, foreign body in it, adhesions in it, growths in it. All that also is done. You can even tell the shape of the uterus. So many congenital anomalies such as uterus diadelphys, septate uterus, unicornuate uterus, and so on. All these will be clearly delineated in your hysterosalpingogram. Can I do this procedure in any patient, or is it contraindicated in some patients? It is contraindicated in pregnancy. You can't do a hysterosalpingogram and expose the pregnant woman to X-rays. So, completely contraindicated even in a possible chance of pregnancy, and of course if the patient is allergic to the radio-opaque dye. So you can use this short bit of my lecture to create a short note on hysterosalpingogram. So if you're liking my lectures, do like and subscribe to my channel. Bye.